My name is Dr. Harshal Rajakar. I am a liver transplant and hepatobiliary surgeon working at Columbia Hospitals at Kharadi in Pune. Hepatitis is one of the commonest problems that we see in common liver function tests that we normally do. Hepatitis is a result of damage to the liver or causing inflammation of the liver. Hepatitis can be because of infections or because of other non-infective causes. Amongst the most common non-infective causes are one is alcohol and the other is fatty liver disease. The infective causes of hepatitis are usually viral, viruses causing hepatitis, or it may be because of drugs and sometimes alcohol. Drugs causing hepatitis is causes drug-induced liver disease and they are rare. But viral hepatitis is rather common, and viral hepatitis can be transmitted either through food and water or through parental route, that is through blood or through injections and infected needles. Viral hepatitis, because of hepatitis A and hepatitis E, rarely leads to fulminant liver failure. Fulminant liver failure is massive damage to the liver, which is usually not able to recover by itself and will require a liver transplant. These instances are very less common. However, hepatitis B and hepatitis C are viral diseases that are chronic. Chronic are long-standing liver diseases and they lead to progressive liver damage over months to years. Once the liver is damaged and the liver becomes scarred, then a condition called as liver cirrhosis develops. Liver cirrhosis is defined as scarring of the liver, which is irreversible and that eventually affects the function of the liver. Once the liver function is affected, then the patient will get jaundice, the patient will get water in his abdomen called as ascites, he will start getting swelling of his feet and hands, he may be having encephalopathy or affection of his brain function, and these are markers of liver cell failure. Once there is liver cirrhosis and the liver function is abnormal, then the patient needs a liver transplant. We do liver transplants at Columbia Hospital in Bangalore, and we are about to start a liver transplant program at Columbia Pune. Columbia Pune is already doing kidney transplants at Kharadi itself. Hepatitis B and hepatitis C, in addition to causing liver damage, can also cause liver cancer. Many of these liver cancers can be operated upon with surgery and carefully dissected out, and the patient will not need a transplant. But if there is a cancer in the setting of liver cirrhosis, then the patient is best benefited by a liver transplant. Liver cancer developing in the absence of cirrhosis can be treated with liver surgery. Apart from liver failure, cirrhosis also causes portal hypertension, or that is increase in the pressure of the portal vein. Portal vein is the vein that drains all the blood that is supplied to the intestines, the stomach, the esophagus, and if the pressure rises, it leads to portal hypertension. Portal hypertension causes dilatation of the veins in the intestines and the esophagus, and this can be varices. These can often lead to bleeding, and if bleeding is detected, that will require endoscopy and control of the bleeding. Portal hypertension can also develop in other situations which are non-cirrhotic, which do not require a transplant, and there are other methods to treat it. But the commonest cause of portal hypertension is liver cirrhosis. With the recent epidemic of fatty liver and non-alcoholic fatty liver disease, the liver damage due to fatty liver is becoming increasingly common. Fatty liver because of modern lifestyles, abnormal food habits, stresses, lack of exercise, and poor habits leads to liver damage. Fatty liver in about 20% patients will progress to liver damage, what is called as NASH or non-alcoholic steatohepatitis, of which about 20% will progress to liver cirrhosis and they will eventually need a liver transplant. To control fatty liver disease, modification of lifestyle factors, diet and exercise are very important. At Columbia Pune, we educate patients regarding lifestyle modifications, control of liver health. We perform vaccinations for hepatitis B, and we also treat patients with other hepatitis and non-alcoholic fatty liver disease.